The information found in this podcast is not intended to be a substitute for treatment from a licensed mental health professional. This is a special edition of the Honeybee Podcast in acknowledgement of Self-Injury Awareness Day. Self-Injury Awareness Day is a day of international awareness that takes place each year on March 1st. It is a day meant for learning about self-injurious behaviors and for providing resources to those who are in need of support. An orange ribbon is typically worn to represent a sign of hope for a misunderstood problem and symbolizes this day of awareness. Self-injury, also known as self-harm, is the deliberate action of causing physical pain to oneself and is a dangerous sign of emotional distress. Adolescents are at the highest risk for self-harm injury. Many studies identify that roughly 15% of teenagers and 17 to 35% of college students have engaged in self-injurious behaviors. Cutting, skin carving, self-medicating, extreme scratching or burning oneself, as well as punching or hitting walls to induce pain are examples of self-injurious behaviors. Other examples include ingesting toxic chemicals, extreme skin picking or hair pulling, and deliberate interference of wound healing. Here are some interesting statistics about self-harm. Each year, 1 in 5 females and 1 in 7 males engage in self-harming behaviors. 90% of people engage in self-harm during their teen or pre-adolescent years. Nearly 50% of individuals who engage in self-injurious behaviors have been sexually abused. Approximately 50% of those who engage in self-harming behaviors begin at the age of 14 and continue on into their 20s. Many report learning about self-harm through friends or through pro-self-injury websites. And finally, approximately 2 million cases of intentional self-injury are reported annually in the U.S. alone. I would like to thank the Center for Discovery for the helpful information that I just shared. Today's episode was inspired by Self-Injury Awareness Day, as well as by a letter that I received from a concerned parent. In this episode, I will be discussing the function or purpose of self-injurious behaviors and ways that parents can get a better understanding of how to approach the conversation with their child. And now, here is the letter that I received. Dear Honeybee, 6 months ago, I noticed cuts on my daughter's legs. When I asked her about it, she said that cutting helped her. I spoke with her about what had been going on at the time to figure out what led her to do this. For the most part, the conversation went well. At the end, I made her promise me that she would never do it again. A couple days ago, I noticed cuts on her arms, and I punished her because she broke a promise. I don't understand her. Is she doing this just for attention? Self-harm without intent to commit suicide is known as non-suicidal self-injurious behavior or non-suicidal self-injury. The behavior can come about in many forms, like cutting, scratching, burning, swallowing sharp objects, ripping or pulling at the skin or hair, or by hitting oneself or hitting objects with the intention of injuring oneself. The Cornell Research Program on Self-Injury and Recovery studies find that it is unclear to determine amplified risk factors depending on one's gender, race, sexual orientation, or socioeconomic status. Although one's gender can affect the expression of self-harming behaviors. It is important to note that, and I will share the distinction later on in this conversation. Now, self-harm is a maladaptive, ineffective coping mechanism. It works in the short term by relieving overwhelming, unpleasant emotions like anger, sadness, and shame, or even embarrassment. In the long term, self-harming behaviors present a myriad of issues like desensitization to pain, like less sensitivity to pain, greater use of the behavior to create soothing effects, and the possibility of accidentally committing suicide. Now it's important for me to take a moment to explain the following. Every human has an emotion regulation system. Our emotion regulation system allows us to process things occurring internally as well as outside of ourselves to gauge our perception of it. It can allow us to have physiological responses like my stomach dropped, my throat tightened, my armpits got sweaty, and then there's this wave of emotion or a wave of physiological experiences that we name, i.e. emotion, sadness, happiness, excitement, embarrassment, shame, guilt, and the like. Everyone has an emotion regulation system, and just like everyone, our emotion regulation systems are unique from one another. So what I found in my reading and experience as a clinician is a driver to self-injurious behavior comes from an amplified emotional sensitivity. There again, cues happening internally, what I think, what I feel, what my body did in a situation, as well as external factors, what happened, how I processed it, and the like. There tends to be a heightened reactivity to emotionally activating cues and a slow return to baseline. Like I mentioned, there are unique differences in every person's emotion regulation system. It is important to note that even in a family, there are, of course, different temperaments. You may have someone who is very calm and relaxed, someone who is more excitable, someone who is more sensitive. So stepping outside of the differences that can happen person to person in a collective, we have differences within a family system. An additional thing that can affect a person's emotional experiencing is whether or not they're hungry, angry, lonely, tired, lack of sleep, substance use, a blowout in a relationship, various things. And what I found is a sensitive, also known as sensitized emotion regulation center increases one's urges to engage in non-suicidal, self-injurious behavior. I meet a lot of youth who have engaged in self-injurious behaviors for a variety of reasons. And I have found that if I am not treating an adolescent who previously engaged in the behavior, that they know someone who does, and quite personally. Many people think that a person who engages in self-harm is intending to kill themselves. That is not always the case. 3 out of 5 people who reported engaging in self-injurious behavior identified that they did not use the approach as a means to complete suicide. Self-injurious behavior is considered, again, a maladaptive and ineffective behavior that is typically used to manage stress or overwhelming emotions. If the person does not learn strategies to manage their stress and their emotions, as well as unhelpful and overwhelming thoughts, the self-injurious behavior could lead to suicide, even if by accident, because the behavior continues on, and there is a heightened tolerance to pain, and an additional factor that I will share. It's important to note before I share more about the additional factor that leads to the tolerance of pain and the possibility of committing suicide by accident if self-injurious behavior continues on for a long period. It's important for me to note that in some situations, there can be an early onset of self-injurious behavior that can occur as young as 7 years old, and may manifest itself by the child engaging in headbanging behavior or hitting themselves on the face, pinching themselves, digging into their skin, different things like that. Typically, though, the behavior can be observed during mid-adolescence. That's somewhere between 13 to 17 years of age. People who engage in self-injurious behaviors are likely to use multiple methods of self-injurious behaviors and perhaps injure themselves on various parts of their body, although it is common for the person who engages in self-harm to have a preferred method and location on their body to injure. Let me do my best to explain more about the biological connection between the self-harming behavior and the brain. So, within the brain, there is an endogenous opioid system, and that system will be referred to as EOS moving forward. The EOS dumps opioid neurochemicals from the brain into the bloodstream, which increases the feelings of comfort, and it gives the person a sense that things are integrating, coming together, beginning to make sense, starting to settle down. When emotions are amplified and thoughts are very painful and unpleasant, the person who does not have a skill set of effective strategies to practice with managing those things and tolerating the stress associated with them may engage in self-harming behavior, as I mentioned before. So the opioid system is clearly involved in altering the perception of the painful situation that is happening emotionally, cognitively. It also helps with altering the perception of that person's sense of time. It may slow things down. It may stop things. It also changes their perception of reality in that moment. The consequences of engaging in the behavior over time leads to a tolerance effect, essentially creating less pain reaction for the person who engages in the self-injurious behavior. Now, having less of a reaction to pain then creates less opioids in the bloodstream. So the more pain that I can tolerate, the less opioid neurochemical will be dumped out into my bloodstream, and I don't have that soothing after effect that I initially had when I began to self-injure. I hope that this makes sense. Now, when the brain has less of a reaction, the person goes through withdrawal symptoms of the opioids, and the urge to engage in the self-injurious behavior heightens. The more that I have the urge to self-harm, to try to get the same soothing after effects, the less and less pain reaction I have, the more and more I cut to attempt to get those neurochemicals that I previously got early on in my behavior. It's been my experience more often than not, the person who engages in self-injurious behavior can typically connect the urge to engage or the act of engaging in self-harm to some triggering event. In a situation where there is a heightened tolerance to pain and less functioning of the EOS, the person may engage in self-injurious behaviors without a triggering situation. Now, going back to the point that I had made earlier about the emotion regulation system being more sensitive than perhaps other people's emotion regulation system, because of this heightened sensitivity, the youth is experiencing emotionally suggestive situations internally and externally far stronger than a person with a typically functioning emotion regulation system. So that means their shame is stronger, their anger is stronger, their sadness is stronger, their overall emotional experiencing is heightened. Earlier in the conversation, I made mention of Cornell University's research and them creating the study about self-injurious behaviors and noticing that self-injurious behavior is not driven by someone's race, socioeconomic status, religious beliefs, or the like. And I made a distinction about the differences in the expression of self-harm based upon biological gender differences. So to that point, while there are commonalities in the expression of overwhelming and unpleasant emotions that are associated with self-harm, there are also differences based upon biological sex difference between males and females. For example, research shows that males tend to express unpleasant, overwhelming emotions outwardly and are more likely to display the aggressive, impulsive, reactive, and hyperactive responses to their emotional pain. Females, on the other hand, are more self-directed in expressing their unpleasant and overwhelming emotions. This is shown by engaging in self-injurious behaviors like cutting, chronic eating disorder behavior, and so on. And even though research shows that there are differences in the expression of overwhelming emotions and self-injury based upon gender, this is not necessarily absolute concrete fact. You may have a male who engages in eating disorder behavior, and I know that there are males out there who do. You may have a female who engages in aggressive, impulsive, and reactive, hyperactive responses, and I know that there are females out there who do. So please be mindful of the distinction and the similarities and the possibility that opposite sex may engage in behaviors that are not typical for their gender. So back to the concerned parent who wrote in to ask Honeybee. This parent wants to know, why is my child self-harming? Is she doing this for attention? Is she doing this to manipulate me? Does she want to commit suicide? The parent in this situation is understandably confused about why her child engages in the behavior. Because the child cannot put language on her experience, the parent is left concerned that the child could be trying to get attention or possibly trying to kill herself. The parent has shown concern and care about the behavior, previously speaking with her at length, who at the time was remorseful and agreeable to never engage in the behavior again. Both parties are left feeling lots of unpleasant feelings once and if the behavior resurfaces, which in this case it did. Now that we know more about the function of self-harm, how it soothes emotional pain, and why, we realize the possibility that the youth is not engaging in the behavior as a means to manipulate her parent or seek attention, and possibly the behavior is not indicative of the youth's urge or intention to end her life. And we also learn that if the youth does not learn alternative behaviors to manage her emotions, stress, and her thoughts in a skillful way, she can experience a greater urge to engage in self-harming behaviors in effort to activate the EOS for the opioid neurochemicals. Let me take a moment to thank Cornell University's Self-Injury and Recovery Research and Resources, as well as Safe Alternatives, which stands for Self-Abuse Finally Ends, for supplying a helpful list to help parents and other meaningful adults in a child's life learn how to approach the discussion of self-injurious behaviors in a skillful way. The first action step for the parent to practice is get mindful. Take an internal tour and get intentional about noticing what your body is doing, what thoughts you're having, and what emotions are coming up for you, since you now suspect or have discovered that your child is engaging in self-injurious behaviors. This skill does not require an extensive amount of time. Do your best to practice breathing through the experience. While it may feel like forever, taking an internal tour takes under a minute to practice. Being aware of how you're feeling and what you think about the situation would be my next piece of advice to you. By doing so, you will allow for greater success in making choices that are in alignment with your true goal, which is getting your child the support they need. Now, for the parent who has not discovered factually that their child has engaged in self-injurious behavior and is suspecting or concerned that their child has or will engage in self-injurious behavior, detecting self-harm can be difficult. So I offer the following helpful ideas to assist you in figuring out if it is a possibility that your child is engaging in self-harm. If you notice inappropriate dress for the season, for example, long sleeves in the summer, or an unwillingness to participate in events that require less body covering, swimming, for example, could be a cue. Now, every child is different. If your child is someone who has never been one to enjoy swimming or has never really felt comfortable with having parts of their body exposed, be mindful of that. If you notice that your child is constantly covering their wrists or forearms with bandages or bracelets, that could be a cue. If you notice that your child has razor blades, knives, or other tools that could be used to cut or puncture the skin, that could be a cue that your child may be engaging in self-injurious behaviors. Now, getting tattoos or piercings are not considered to be a means of self-harm. That's important to note. I encourage you to speak with your child about the behavior. Ask if they engage in the behavior in effort of attempting suicide. Ask how long they've been using the self-harming behavior to cope. And if they're able to, ask them to identify what leads them to engage in the behavior. I super duper duper encourage you to seek the support of a mental health professional. A mental health professional will assist by providing a clinical assessment and, with participation from the youth and you, will help with creating helpful interventions by teaching strategies that will assist the youth with practicing alternate, skillful behaviors, which over time will reduce and remove the self-harming behavior as an option for their emotional care. So to bring this all together, remember, if you suspect or discover that your child is engaging in self-harm, take a beat and practice being mindful of what your internal experience is after knowing what you know or what you think you know. When we do not notice how we feel, we are more likely to say and do something that, down the line, could create more frustration and pain in the relationship. Then think about what your goal is during your chat with your child. Do your best to practice keeping your goal in your awareness while you speak with your child. Your child may react with tearfulness, or they may shut down. Your child may react with anger. Please know that more often than not, they are afraid of people, especially you, finding out about their behavior, and they're worried about the consequences, like getting in trouble, even more, disappointing you. In speaking with them, be sure to lead with curiosity. Not only will your curiosity help the conversation flow, it will also block the intensity of anger that you may have from creeping up. Make sure you avoid making harsh judgments and be sure to avoid dismissing their experience. Invalidating what they say or criticizing them for what happened will enhance the possibility of your child hiding the behavior more and corroding the relationship you two have with one another. Be sure to ask them if their intention was to commit suicide and ask them if they have suicidal thoughts often. If so, it is important to create a barrier between your child and any objects that can be used to end their lives. This includes medication. It is important that lethal means are removed from the home or locked away while your child is in this high-risk period. If you need additional guidance on how to speak with your child about this piece, I will share information to a few wonderful resources that can be of support to you, and this information will be in the show notes. At some point in the conversation, ask them what influences them to self-harm. If the youth is able to identify this with you, that is additional information that will be helpful during their work and your work in therapy. Some children will have difficulty with this last piece, and understandably so. This is a frightening experience for both you and your child. Finally, let your child know that you care about them and that you want to get them connected with a therapist who can help you and them with learning strategies to help take self-harm off the table as an option. As best as you can, once the conversation is over, please practice some form of self-care. Undoubtedly, this is one of the most difficult conversations that you will have with your kid. I hope that this information was helpful. I sincerely thank you all for listening to today's episode. Please check out my website, myhoneybeetherapy.com. That is myhoneybeetherapy.com. Like my Facebook page, you can find me there under the name Honeybee Behavioral Health. You can also hit me up over email at honeybeebehavioralhealth@therapist.net. Now, before I go, do me a favor and subscribe to my channel so you can listen to the new episodes from the Honeybee Podcast when they drop. Until next time, peace.